Carney. I'm a professor of nursing at Cal State San Marcos in San Marcos, California. I'm a fellow of the American Academy of Forensic Sciences, general section for 21 years, and now in the forensic nursing science section. The American Academy of Forensic Sciences Introducing Forensic Nursing has, for me, brought to fruition something that's a long time coming. We've worked very hard to be recognized as a section. Virginia Lynch first brought this to the 43rd Academy in 1991 when she was asked to define the discipline. A year later, the International Association of Forensic Nurses came about, and we've been working tirelessly for this moment ever since. And now at the 75th anniversary, here we are with our very first Forensic Nursing Science section meeting. Forensic nursing science is a response nationally and globally to matters of health and legal matters. There are many disciplines inside forensic nursing science. We have been instrumental in both nationally and globally working with victims of domestic violence, interpersonal violence, child abuse and neglect. And more recently, we've become prominently involved in sex trafficking and other matters that have come before us. Legal nurse consulting. Our world has gotten much bigger as we've collaborated with other disciplines. Forensic nurses typically have worked in hospitals, but now we're much more out in the community. We are much more involved with public health, death investigations in MEs and coroners' offices. We're out in the field quite a bit, particularly with death investigations. Nurses with a background in that are no longer attached to hospitals, but with various MEs offices and other forces. Disaster preparedness and disaster response takes place out in the field as well. Forensic nurses work with almost everyone now. I'd have to say we have a pretty wide outreach. We don't just work with physicians. We work with other nurses, forensic nurses, public health departments, entire departments, such as the California Forensic Medical Training Center. We work with safe and sane nurses, sexual assault forensic examiners, and sexual assault nurse examiners out in the field as well in rural areas, not attached to hospitals anymore. Forensic nurses are typically educated as a bachelor's degree in nursing. It is the correct requirement to get into the American Academy as well as the requirement to attend the Forensic Nursing Science section as well. We all have advanced training after that, many with master's degrees and doctorates. Lots and lots of death investigation training post-BSN, as well as sexual assault forensic training, child abuse and neglect intervention, trainings like that. If I was speaking to somebody here at the Academy about joining the Forensic Nursing Science section, I would want them to understand the collaboration and the importance of being with other like-minded people who also want to intervene in things like interpersonal violence, unfairness, and justice, the way the Academy has always addressed. My specialty in forensic nursing sciences is elder maltreatment. I was introduced to that in about 2007 when I was working on my PhD. I used to say I was the buzzkill at cocktail parties. What do you do? Pardon me? Oh, I work in elder abuse. And off they would take for the hors d'oeuvre table and I would never see them again. I have learned to quit mumbling about that. I'm very proud of working in elder maltreatment and neglect. We've only really been researching this for 15 or 20 years, and we really learn more about it every day. And I'm very proud of the work we've done in elder maltreatment. I think the world of forensic nursing sciences has just started to bloom. Our acceptance and our start this year, coupled with the wonderful grounding the Academy has given us for years, is going to make all the difference. We came out of the general section like many other sections have had, and we've had their really endless support in launching the Forensic Nursing Science section. And I see us doing this for other nurses as well as we expand into the future. I think we plan to collaborate with other sections of AAFS in that we have been asked to do so before, which was really lovely. Last year at a talk that I gave, several people came up and asked if we'd be willing to be on a panel in various other sections, and we weren't even a section then yet. And now that we are, I see us collaborating with engineering, certainly jurisprudence. We're working with the general section this year again, and I can see as we become more of a prominent section, more people are going to ask us to collaborate.